What's going on?
Hello and welcome to In the House with Representative Jason Lewis, representing the town of Winchester and Stoneham. And my name's Alan McDonald, and it's my pleasure to be able to host this evening with Representative Jason Lewis. And Representative Lewis, great to have you here.
It's great to be here, Alan, and thank you so much for hosting the show.
Well, this is an opportunity for the citizens to see what's going on with their representative and in the State House, and I know you've been a busy guy, so this will be a good chance to talk about some of the things that are current. And this In the House show we'll have on some other times as well, so that there's a regular opportunity for the citizens to catch up with you. Now, while we're sitting here talking, Representative, it's raining like crazy outside.
It is indeed. Hard to believe we just got through one major storm and now we're in the midst of another one.
Well, that's right, and we hope it's nice and dry when the folks get the chance to see this program. But in the meantime, we've gone through, and you've been part of helping out with the flood mitigation program here in the Winchester-Stoneham area. And you know, of course, we've had the 100-year floods, or certainly 75-year floods in 96, 98, 01, 06, now it's 2010.
Right.
And the town has been working quite a bit with the Department of Public Works here in Winchester, so speaking of the Winchester government now, but now with the state to take a look at what the Department of Environmental Protection and other agencies will allow us to do as we're trying to control this problem. But you've been very much involved in it.
Right. Well, it is a huge challenge for Winchester and has been, as you said, for a long time. You know, all of the upstream development from Winchester and Woburn and other communities has meant there's a lot greater volume of water that's flowing down the Aberjona and other tributaries into Winchester, and was never meant we could. The development here was never designed. Our infrastructure was never designed to accommodate that kind of flow, and so the community, I think, has really tried to build a flood mitigation plan and look at a number of different projects upstream and downstream in a way to alleviate the flooding that our residents and businesses are facing, but without shifting the problem further downstream to Medford and Arlington and Somerville and other communities. And I think working very closely with those communities, and as you said, with the state's environmental agencies, we have a plan now, and we're hoping to have that plan approved very soon.
Have you been seeing this in a state level as well? I know the governor has declared a state of emergency on this current storm, but as you see in the legislative work, a lot of the other communities that have similar problems to Winchester?
It's a huge statewide problem. There's just not, as we've had more and more development and more surfaces that are paved over for parking lots and shopping centers and housing, there's more impermeable surface, and we don't have the traditional floodplains and opportunities for the water when you have heavy rain to run off. So this is a problem we're seeing all over the North Shore. There was bad flooding in Quincy, and it's on the South Shore. So eastern Massachusetts has been hit hard, but Winchester is certainly one of those communities that's really been battling flooding. During the storm a couple of weeks ago, we had some officials from the state's environmental agencies come out to the town right on that I guess it was on the Tuesday, so right after the rain had stopped, and they got to see for themselves just how bad it is over on Brookside Ave and by the high school and Mount Vernon Street, and took them all up and down the Aberjona through the town. So we're hopeful that they understand how serious it is and how much of an impact it has on homes and also on businesses.
Well, as you point out too, it involves a lot of communities in the area, so it's the problem that we have probably originates upstream, of course, in the Woburn, Burlington area and further up than that probably. And then we have to be careful how we manage it to send it along.
That's
So it's going to involve a number of communities, and that's really where you
That's
can
right.
be a tremendous help.
That's right, and I give a lot of credit to the town, the selectmen and the planning board and other officials who've been working with the downstream communities and upstream and the state for the last several years. And in fact, a major milestone that we just had recently was the filing of an environmental impact report. The comment period on that, the public comment period, closed last Friday, and so we expect a decision from the state's Energy and Environmental Affairs Secretary, Ian Bowles, this coming Friday.
Okay.
So we're very hopeful that we will now receive approval, and then there's a series of more than a dozen projects, as you know, that have been proposed to allow better conveyance of the water through Winchester. Now we just have to work to get funding for those projects, some of which we will allocate from our own resources, some of which we're looking to get state and federal support, and that's a top priority.
Well, hopefully with the attention that the entire state is getting and the federal government, of course, we know that the state has applied for federal relief on the current
Yes.
flooding, that we might get to see some more support on the capital side from state and federal monies.
Yes. In fact, we were in conversations with Congressman Markey's office just the other day, and they're starting the federal appropriations process now for the next fiscal year, fiscal year 11, which starts in July. And he's putting forward a number of our flood mitigation projects on his priority list for federal funding.
Well, that'll be great, because what I understand from the discussion we had here last week with Selectman Jim Johnson, Town Council Wade Welch, and Mark Toogood, our Assistant Town Manager, we were looking at some perhaps $14 to $16 million of work on the full total
Yes.
mitigation project, so
Yes.
which would be done over time, so it wouldn't come out
Right.
of one budget, but it would be a very major expense over time.
That's right, it is certainly more than 10 million, and one of the biggest projects is actually not in Winchester, it's down in Medford, and rebuilding the Main Street Bridge and the Craddock Locks,
Yes, that's right.
so we can get better flow of the water through there. But that's something that Medford and the state have committed to as a priority.
That's great. Well, we're all in support of the work you're doing. We're looking forward to it. There's been such a devastation for some of the local residents and businesses over time from this that it really has been harmful, and we need to.
It's just so tragic when you visit some of the homes and businesses and see the impact. And I had a chance to walk around some of the neighborhoods after the last flood, and there were some cases where many of the homeowners and businesses have been through the flooding before, as you said, and so they're prepared. They have pumps, they've installed drain systems, they've done all the things that they can do. What happened in the last storm earlier in March was the volume of water was just so great that when they were, in a couple cases, I saw basements where they had been able to keep the water out through most of the storm, but the water pressure was building up all around the basement and underneath because the ground was so saturated. Because the difference in pressure, the basement floor literally exploded. And they described it as it was almost as if an earthquake had taken place. I've never seen anything like it, and it happened in a number of homes. So
Oh, and truthfully, this
hopefully we can get some help
right.
from the federal
we
disaster
really did
declaration.
not see that kind of thing happening prior to the 1990s. So naturally, the buildup upstream that has sent more water our way has been a problem, and so we've got to manage it, which we didn't have to worry about up until the 1990s. But
That's right. And I think because of that increased development and less permeable surface, what would have been a once in 100 years flooding event is now, who knows, once in 20 years, once in 10 years. It's
I
more
think
frequent.
in '96 we thought that would be it, but no. So thank you for working on it so much. This is going to be
It's a good team effort, I think, between our local officials, the state, and federal government.
Well, you're involved in a lot of other things that aren't just today's issue. That's, of course, the flooding is going to be long-term too. But the healthcare issue
Yes.
probably is as visible and talked about an issue as there is in the political world nationally and in Massachusetts, because we're doing something different than all the other states are doing. Tell us a little bit about your involvement in that and how you see where we might go from here, I suppose, in Massachusetts.
Well, it's a very it's a critical issue to all of us. And as you know, with your role in the Business Roundtable, you were involved in 2006 when Massachusetts really led the nation in trying to reform healthcare to make sure that everybody has access to healthcare. I serve on the healthcare financing committee within the legislature, and so we're very active in looking at that healthcare reform in Massachusetts. What's working, what's not working so well, what do we still need to fix? And I think I sort of see healthcare with sort of three pillars. There's access to care so that people are able to have insurance and get the care that they need for themselves and their families. There's quality of care and trying to make sure that it's even and effective care. And then there's obviously cost.
Yep.
And I think Massachusetts deliberately focused on access in the first round of reform and now really needs to focus on cost. The national reform, I think similarly, was more focused on access and insurance reform, with some measures to try to get at cost, but I see it as reform phase one. And as bitter and as contentious as this battle was, I think this is only the first step, and we're going to need to continue to work this issue on the cost side particularly.
I think it's as complicated a public policy issue as there is, and with all the different elements of looking at energy issues and transportation issues and education issues. The most complicated, I think, is healthcare because it really, the right to healthcare is such an important issue for people, for everybody. And the way we've evolved in our healthcare system has really worked in the economic sphere more than just worrying about how do we provide good healthcare.
Right.
I think from the public policy side.
Right.
I have never seen more discussion on cost management than there is right now. That's true. And I think we got there because Massachusetts, I say this, never saw more in Massachusetts on this, but we got there in 2006. It'll be 4 years this month of April that we had that bill pass, which you're absolutely right, was more about access than cost. But it was a very important step for Massachusetts that we were able to take, I think, because we had the free care pool to take care of those people who could not pay for health care since the mid-'80s. So from 1986 to 2006, took 20 years to evolve for what I would say is a better use of the money that was put into the free care pool as a surcharge on insurance, as state money that went in, extra pay for people who stayed in hospitals. But now that money is more used to subsidize where necessary for insurance coverage.
Right. And hopefully to ensure that people are getting more access to primary care, preventative care, so they're not ending up in an emergency room when the condition is much worse. And we have seen evidence of that has been working over the last several years. So that's progress. I think it's unfortunate, and you and I were talking about this before the show, that a lot of good work that Massachusetts has done was unfairly demonized, I think, in the rest of the country by those who were opposed to healthcare reform, and for example, made claims that this was that it was unsustainable, and that's not the case. There has been an increase in healthcare costs, but those have been largely driven by the recession and more people losing their jobs and requiring access to Medicaid. But that wasn't specifically as a result of the healthcare reform here.
Right.
So I thought that was an unfortunate part of the national debate, that rather than having a civil discussion really based on the facts, because there's room to agree and disagree. Healthcare, as you said, is enormously complex. It ended up getting, I think, demonized in a way that
I think it was
just
very
divided
unfortunate
people.
that it wasn't, just as you say, discussed more, because I think even those who didn't like the proposals that were coming out of the Washington process recognized, at least they said they did, that we needed to address the healthcare circumstance. And so it should be addressed. And that requires discussion and experimentation even, because in this great world of social science, which this is, there's not one answer, and there's not a forever answer either, because circumstances change. So you really do need to have people talking about how we're going to do it, and I hope that the Massachusetts experiment, which the legislature was good enough to put forward, will provide examples as we go forward for the next step on how
Right,
to do it.
and that's a good segue because there is, even before the federal healthcare reform, Massachusetts had begun really looking hard at the cost issue. And there was a blue ribbon commission that was put together, as you know, with representatives from businesses, the Hospital Association, physicians, other healthcare policy experts, and they looked at all of the different ideas that have been tried to better manage and control costs, and they recommended moving over time from essentially a fee-for-service system, which is largely what we have today. You have a test or procedure, you're hospitalized, and then the insurer is billed, or the government is billed for that procedure or service, which does have a tendency to drive more tests, more procedures, and greater utilization, sometimes unnecessarily. So to move from that to a system of what's known as global payments, which is essentially a budget, providing a budget which would be on a patient basis. It's not simple. It has to be adjusted for different factors, and we want to make sure it's not used to deny necessary care to patients. But that model has been shown to work already. Blue Cross has been running a program like this here in Massachusetts. So we have examples that this can actually help us to better control healthcare costs. So now the state is in the midst of starting to move to that type of a system, and I think that will lead the way forward for the rest of the country.
What I see is momentum building to get that experiment underway, because to follow up with a pay review commission that the state had to say this is something we should look at. What we see is the fact that the healthcare system has more than half its monies come in from Medicaid and Medicare, so public monies to pay for what is a tremendous system. It was built up from the 1950s until now through subsidization of both private and public, and a lot of investment that has built a system up that can't be supported by public money on a fee-for-service basis, it turns out, because the budgets are so tight, both federally and state, that fee-for-service, really the cost for the service is underpaid by the public dollars, and that means that the rest of us who have to pay privately fee-for-service pay a little bit more than probably they would have to fee-for-service wise. But if we can change the way that that's delivered to match up with a global payment, and you folks are going to be working very hard on that.
And what gives me optimism that we can do this is because there are so many examples around the country of outcomes for particular conditions, whether it's a heart attack or a stroke, that are as good, if not better, than the outcomes that are taking place in other places where the amount of money spent on the care is dramatically lower. And we've seen this over and over again. So that says to us, and you look at the experience in other countries where they spend, in many cases, half of what we do in Europe or Asia, but get outcomes in terms of life expectancy, infant mortality rates, as most people probably have heard by now, that are better than what we're getting. So I believe it doesn't mean you have to ration care. It doesn't mean you can't get the care you need. But just by doing things smarter and making sure the care that's given is really the right care and necessary and better preventative care, I think will make us all healthier and less expensive care.
Well, it's something we're going to work on, and we're going to keep working on it. And I agree that the direction of looking at the so-called global payment could help us out, especially if we take a look at the great amount of expenses is for 10 to 20% of the cases, whether it's 70 or 80% of the money spent for 10 to 20% of the cases. If we had case management for chronic care that was not fee-for-service for incidences of care, but for a general incentive on overall care, we do feel, I think, from what you've been working on, that would be a more efficient and even more healthy way to take care of the population. I mean, one of the things we've seen in working with the consumer-directed healthcare plans is that there is an opportunity to avoid unnecessary expenses in the system, those things that don't necessarily add value to the health of the patient, or avoidable costs, and the avoidable costs are better health, better wellness, better case management to avoid costs, or what I would say maybe inappropriate costs in some cases where the result is the same, so that when Winchester Hospital provides care that's at a lower expense than a more expensive place that would give the same result, that might not be the appropriate setting, that more
Yep.
expensive place.
Yep.
And there might be a chance for us, as we work with the Winchester Hospital and those folks, to see the value of community care.
That's a great point. I've spent a lot of time with folks at Winchester Hospital, and they're obviously one of the top-rated hospitals in the country, a top-rated employer too. And the Attorney General just came out with a report and looked for very closely at what are the drivers of costs. And they looked at billing records between providers and insurers. And what she found was there was really no correlation where costs were higher, either driven by better quality, better outcomes, more complicated medical cases. So controlling for all those things, that didn't drive. There was no correlation. And what they concluded was it was simply a matter of market power. You have a marketplace. And this goes back to my first year in college in my Economics 101 days.
Right.
You just have a market that doesn't work properly. You don't have supply and demand working properly, and so you basically have the ability of certain providers with market power to price higher, and that disadvantages hospitals like Winchester and other community hospitals.
Well, it's an interesting thing, isn't it, in the healthcare, that you just mentioned supply and demand, and as supply has increased, demand increases with it. And you never get to a point where supply outpaces demand because it is subsidized.
And it is, and it's not transparent. Many people don't even know what they're spending because they don't see those bills.
And it's not subsidized by just the public side. It's subsidized if you and I have the same plan through our employer. We're all in. The highest paid employee and the entry-level employee are all on the same plan. And if the higher paid employee makes that more expensive decision and doesn't have to pay anything more for the more expensive decision that has the same result as the less expensive, the entry-level employee is subsidizing that choice in the plan. So it's not just public subsidy, it's private. And we get away from that a little bit with some of the discussion that you've been having. And again, to what you just said about the transparency, to create a market so that you and I know the value of the more appropriate, I'll say, not less expensive, more appropriate spot for the care.
Right.
Yeah.
Well, I hope so, and I think the state's already made some good strides in that area in improving transparency and helping people to understand, what the quality is of different providers and starting to understand costs better, and so that helps people make better decisions.
That's great. Well, I do want to take this opportunity while we have today's discussion to talk about some of the other things too that you've been very active. I know that in the news is the anti-bullying statute that you passed, and you were active and wrote about it, and I think that's something that the community is very interested in.
Yes, I have to tell you some of the most difficult conversations I've had since I was elected a year ago are with parents who have told me the stories of their children and the bullying experience they had. It's just heartbreaking. There was one family in particular, now lives in Winchester. They actually had to move away from the community where they were living before because their son was being so badly bullied, and they couldn't get an appropriate response from the school. And in many cases, these are also children who have certain disabilities. So that makes it even where the family's already dealing with some challenges, and this makes it even worse. So I think this was an important legislation that passed in the House and Senate, and I think the governor will probably be signing it any day now. And we should acknowledge that many schools do a great job, and I think that's, from what I've seen of my own children in the Winchester schools, that's the case. Our schools are very sensitive. They have a zero tolerance policy when it comes to bullying. Unfortunately, that's not necessarily the case, as I just mentioned, in this district where this family used to live, and in others. And I think the message is we will not tolerate that anymore, and schools and communities will have to have a zero tolerance policy. And I think it's long overdue. We've had 2 tragic suicides. One was in the news today because there was the results of that trial, and there were some convictions handed down. And let's hope that it doesn't happen to any more students.
I think that the education, and I agree with you, the administration through the years in the Winchester schools has been very attentive and has worked on educating the students in the community about bullying. And I suppose when my generation grew up, we really didn't think about it so much. There was teasing, but I don't know that I was ever a witness to any real bullying. The teasing for sure, but I don't think that even the teasers realized the negative effect of what they were working at. We know that now, and we know how serious it is, and I think that was a very good thing that the legislature got involved.
And you're right, and what's changed also is it used to just be maybe on the school grounds, which is bad enough, but now it follows these kids home because they get bullied and teased on Facebook and through instant messaging and online, so they're harassed around the clock.
Okay,
and so it's just the amount of bullying and the impact it has gotten much greater because of technology.
Well, tell me too, while we're on the education, we only have 4 or 5 minutes to go, which this program goes by so quickly for me. I hope it does for the audience as well. I bet it does.
Hopefully they're still awake.
That's right. I'm sure they are. I know they are. Race to the top. You passed some legislation very recently to allow Massachusetts to compete for federal monies in the race to the top on education. And by doing that, Massachusetts was successful in the first cut of 40 states applying. 16 got to the next level. But today we know that 2 were chosen without Massachusetts, but we're still in the running for another 5, I would hope. Huh?
We are, and you and I were both at the signing ceremony at the Boston Children's Museum when the governor signed the education reform bill passed in January. And that was very important because although Massachusetts leads the country, and in fact in some scores leads the world when it comes to the performance of our students, at the same time we have a huge achievement gap between our best students and our worst performing students. And most of those students are in urban areas and are poor and minority students. So we took some important steps there, I think, to help to combat that achievement gap. And one of the benefits of that also, it makes Massachusetts in a better position to qualify for this, as you said, the race to the top funding. And I'm hopeful that because we were a finalist, that we will still receive potentially up to a few $100 million in the next round, which is going to be, I think our deadline is June 1st,
I think,
so
to file, and
it's
then,
not too far out.
And there'll be a decision, I understand, in the fall, perhaps as early as September on that. And my memory is that we filed for some $287 million over a 3-year period, which would be a tremendous help for all the communities. And the stress that we're under in the town of Winchester with the growing school population every year, and we have talked about that with the selectmen and the school committee a little on the WinCam shows. But we really could use that kind of help.
You're right, and we've grown from 2,800 students in the early part of the decade to now we're at 4,200 in the Winchester schools. So it's an attractive, great community to live in. Part of that is the school system. To me, there are when it comes to education, 2 major challenges facing the state. One is what we talked about, is the achievement gap, and I think we're starting to really tackle that. But the other, which we have a lot of work to do, is the education funding system. And that's probably a topic for another show, but we have the Chapter 70 formula, as you know, and that is an attempt to try to determine what amount of money is required for each community to provide a good education, and then to allocate state funds to supplement the local funds that communities have. And that formula is 15, 17 years old now. It's out of date. I don't think it accurately captures technology costs, healthcare costs, special education, and there are problems with from an equity standpoint as well. So one of the top priorities for me, and I've talked with the Education Commissioner Chester about this and fellow legislators who share the same goals, is to really take a fresh look at that formula. Where is it working? What could we be doing differently and better? And I'm hopeful now that we've addressed the achievement gap, which was the next priority, that now we can focus on education funding, and the governor's been very supportive of this as well.
Well, I think the attention you're giving to it in the legislature is excellent, because it is absolutely a key to all the communities, and things don't stay the same from 1993 to the year 2010. Populations change.
Didn't even have the internet. Back then it was DARPANet, and
that's right.
Nobody had heard of it.
There's something in that.
The world's changing so fast.
Well, this has been an enjoyable chance to catch up, and there will be other issues that we couldn't cover today, but will another time, and maybe some of these to come back to too, because they're continuing issues that are important, and thank goodness
s-
you're in there with the eyes and ears on these things.
I
for the
suspect
town of
certainly
Winchester.
healthcare and education will be two we return to time and again.
I think so too. Well, thank you one and all for joining us for this edition of In the House with Representative Jason Lewis. It's been a pleasure to review some of these issues that we are dealing with, and we'll do some more in the future. Representative, thanks so much for this
Thank
opportunity.
you.
Hello and welcome to In the House with State Representative Jason Lewis, representing the town of Winchester and Stoneham. And a pleasure to have you with us,
Great to
Representative.
be back with you, Alan. Thank you.
This is great. We're in the middle now, in the House of Representatives, and what I look at is kind of the playoff season that the Bruins and Celtics are going through, the Super Bowl. You've got a lot of things going on, and in just a couple of months to wind up the session. So it'd be great to have a chance to help the people in Winchester know what's going on, because you're a very busy guy right now.
Well, I enjoy doing the show with you, but I wish we could be at the Celtics game tonight.
I know it, huh? Well, when this is being aired, we'll hopefully have got them in the next
That's
round
right.
already.
That's right.
Uh, This is budget season, the same as it is at town meeting for our spring budget. You've been very, very busy in the House, and you've passed a significant, tight budget for us to take a look at and have the Senate vote on. But you may want to talk a little bit about what you've been going through.
Sure. We did just pass a budget in the House of Representatives. This is for fiscal year 11, which starts July 1st of this year. It's been very challenging, as you know, because of the global recession that's significantly reduced the tax revenues that the state receives, income taxes, capital gains, sales taxes. So the state, for fiscal year 11, is looking at about a $3 billion gap between projected revenues and just trying to maintain level services. And so we had to address that $3 billion gap, and we were very aware of the difficult situation facing many families and businesses. So there was an agreement to not increase any taxes, no new revenues. And so as a result, that required about $1 billion, a little more than $1 billion in some very difficult spending cuts, basically across the board. And then we're fortunately able to still tap some federal stimulus money, which is helping us bridge this through this recession. So combination of some federal stimulus money, some debt restructuring, and then some very significant spending cuts that we had to make.
It is difficult, I think, at the state level when the economy is not strong, which is now. A lot of times, not only a lack of increase in funds, which would happen in normal times, would happen, but there's a decrease in the revenue that you get, and you've got a lot of embedded programs and needs in the state budget, including local aid, which we depend on quite a bit at the local level. And I think you've done a lot of good work in trying to pare back the kinds of things that we do consider necessary in times that are good, but that just aren't available.
Absolutely. There's so many things we'd like to be able to do, in terms of higher education and early education, various public health programs, environmental programs, and we just can't do all that right now. I've mentioned this before, but it bears repeating. State governments, and Massachusetts is not unique at all, are particularly hard hit in recessions because the federal government obviously can run a deficit and has the ability to print money and borrow money, and local governments rely mostly on property taxes, which in good times and bad tend to be pretty stable. So state governments have to run balanced budgets, and they rely on a revenue stream that's that fluctuates.
Well, interestingly enough, when Proposition 2.5 passed, which is 30 years ago now, in 1980, it was done on the premise that you could increase the local revenues 2.5% plus new growth, so it comes out to be 3.5% or so on an annual basis routinely. But at the state level, there's no such thing. We don't increase the revenue 2.5 or 3% at the state level.
And we've had good years where back in between 2000 after the last recession, between 2003 to 2007, where revenues were growing 3, 4, 5%. Capital gains increased significantly, but those times are well behind us now, and we've had to do a lot of belt tightening.
Well, it's really an important thing for the Ways and Means Committee and the entire House, and then the Senate after the House does the budget, to try to measure moderate growth and use of the funds. Because you're right, sometimes we have had double-digit increases even in the go-go years of the mid-'80s and mid-'90s. And I think the legislature did a good job in that time, particularly in the 90s, of managing more reserves, and not just when the income was good. Frankly, I think the state did do a good job of planning for reserves, which we've been using the last 2 years.
You're absolutely right, and that's we had a rainy day fund going into this recession that had been built up to $2.2 billion, and we've been able to tap that judiciously. And I think that's why the state's been able to maintain a top-notch bond rating, because we have been able to manage our way through it. And you look at what's happening in California, for example, and it's a disaster. And fortunately, Massachusetts, even the tough times we faced, has not been like that. The other thing I would add is I think going through difficult times in a recession, it does force reforms, which are in many cases healthy, and we've had very good pension reform and reform of our transportation system. So I think those are a good start. I think there's more work we're going to need to do in those areas and others. Healthcare is obviously a big area where we need to focus on from cost containment, but it does force us to really prioritize. And I think really focusing on education. There's been a real commitment from the legislature and the governor to try to preserve K through 12 as much as possible, and mostly done that. Maintain a basic social safety net in terms of homeless prevention and public health programs, and programs for people with disabilities and mental health. And I think there have been cuts there, but in general, prevented that from being completely decimated.
Well, let's talk a little bit about the education piece, and maybe the healthcare and transportation. All these things are of great interest and getting a lot of attention. But the education piece, I know you recently, even this week, I think, had some officials from the state out to take a look at our
Right.
local circumstances,
Yep.
and that could be important.
Yes, I was very pleased. Senator Jalen and I invited Catherine Craven, who heads up the Massachusetts School Building Authority, and that's the state agency charged with working with cities and towns to rebuild schools. And as everyone in Winchester, I'm sure, is aware, we've got some really great school buildings, and we've got some that are not so great, and that are, and our enrollment in our schools has gone from about 2,800 students 10 years ago to 4,200 now. So we've had phenomenal growth, and it's a sign of a great school system and a town that values education. But our classrooms are overflowing, and we've got trailers, portable classrooms at many of our schools. So we wanted to show Catherine Craven and her team, first of all, the Vincent Owens School, which is already in the pipeline, and that project's moving forward to get that school rebuilt. And then also to get her to the high school. The high schools is going to be a major project, but we've got to get started. So it was good for her and her team to appreciate what what our needs are, and we're hoping we'll be able to actually get started on a high school project even before the VO project is completed.
Well, some people might say, well, gee, we had Catherine Craven, state official, out to look, what's new. That's a very important thing, because she is the major domo in
Right.
this situation statewide, as you just said. And she can't go to every single community and be looking at all the facilities all the time. So you're having her out here, I think when we plan ahead, which is always what we're trying to
Right.
do, is terrific. So,
Well, I think it was great to get her. She's very smart. They're making do with, a lot of their revenue comes from, they get 1% of the sales tax, and so with the decline in the sales tax, it's hit them, and they've had to cut back. But we're fortunate also to have a wonderful Winchester resident who Charles Chekaritz, wonderful architect and former selectman who's on the design board of the MSBA. And so she at least had some advanced knowledge of Winchester and our enrollment growth and our challenges. And so it was really good to get her
almost
team
can't
here.
say enough good things about Charles Chekaritz.
Yes.
Charles was on the Winchester Planning Board back in the 1970s, and when we did the 5 elementary schools into housing, Charles was the head of that committee that was making it all happen in the early 1980s and late 70s, early 80s, and did such a wonderful job at Washington School, at Wyman School, at Noonan
Right.
School, all that.
Many people probably don't realize those were elementary schools.
Oh, that's true.
A long time
That
ago.
might be the case.
That's right.
That's
I
right.
mean, many have been redeveloped now. But it is interesting to track the enrollment. I mean, we actually had enrollment over 4,000 students back in, was that the 1970s and
Yes.
80s, and then it came down significantly, and then it's been climbing again since 2000.
That was
So it's an
interesting. We
ongoing
actually-
challenge to
actually
manage that.
had it is a challenge to keep up, because when it fluctuates, because we built to 11 elementaries
Yes.
and then come back down.
Come back down.
But the population fluctuated throughout the northeast section of this state. I mean, it grew a little in Plymouth and Bristol County and that, but in Middlesex County and up to Essex, but where we were in the Middlesex League of schools, all the school populations declined in that period. But now they've come back, but they've come back more in Winchester than other communities.
That's right.
And I think it's attributable to the system.
And it is, and it's not total population growth.
No,
It's the
still
turnover in families with school-age children. In fact, Catherine Craven, the director of the Massachusetts School Building Authority, said that in her view, Winchester is one of only about 10 communities she could think of that are facing enrollment growth. So it's fairly unique, and I'm glad that they recognize that presents a very particular challenge with
right.
lack of capacity.
Because there's, every once in a while at the state level, with people in state government think, well, Winchester doesn't need help from us. And we're serving the Commonwealth as much as we're serving the community here, so that's
Exactly.
very good. And it's very
Exactly.
important to have somebody
Right.
there reminding them and
Yep.
keeping us involved.
That's right, and that was so that's great, and they they've been very responsive. Also, another area that I think we're making good progress is with the MBTA. We have 2 commuter rail stations in Winchester. I think we're in the Guinness Book because
we
we have
are,
the
aren't
2
we?
closest,
Yeah.
both of which need work. And we've gotten notice that we're going to be receiving $2 million in stimulus money for accessibility upgrades at Wedgemere, and a lot of credit there should go to Gene Batty and our Disability Access Commission, and Congressman Markey was very involved in that, and the MBTA officials and the governor. So that's great news. That project's going to start this summer, so that's going to start soon. And then we also got word that the MBTA has included $1 million in their capital plan for next year to begin the design work on the Winchester Center commuter rail station, which everyone knows we've had problems there, and we've had some concrete panels have crumbled, and everyone, I think, would like to see the pigeon nets cleaned up, and lots of room for upgrades there.
It's half a century
Yeah,
old
it's
now,
in-
so...
was it 1950s?
Yeah.
So that's good news that that'll be the first. Well, first they're going to spend $600,000 for just basic safety improvements this summer. Then $1 million is for design of the new station, and then we have to secure the funding for construction, which that's going to be a big project, probably $10 to $15 million.
That's, we've got a lot of projects, and thank goodness. I think we're building off a good base. You and I talked the last time we had the in-the-house session on WinCam about our flood mitigation project, and at that time we were having some serious storms.
Yes.
We had 2 weekends where we really
were
had
right in the middle of it.
serious floods. And I know there's been progress even since when we talked. Maybe you want to talk a little bit
Sure.
about how we're doing.
And that's the top priority for our Board of Selectmen and for myself and state officials. It's been, as you know, devastating. The impact on the downtown, the impact on our neighborhoods up by Morocco School and Washington Street, and in this storm we had people flooding who hadn't even flooded before. So the good news there is that our environmental report that the town worked on for almost 10 years with all the surrounding communities was approved by Secretary Bowles, who's the Secretary of Energy and Environmental Affairs, and that was the critical approval we need to be able to move forward.
Right.
The challenge is that anything we do in Winchester affects downstream communities, and what the state, and then those communities would not allow to happen is for us to mitigate improvements that then moves the problem downstream. So we were forced to work, in a regional basis, and that's so that was important to get that approval. We do have the project, the Mystic Lakes Dam between the upper and lower Mystic, and that's on track, and that project is going to give us ability to store more water before the storms. And the other project that is just starting is down at in Medford at the Craddock Locks, which used to be where the tide was managed before the new the Amelia Earhart was built. So those 2 projects are key projects to allow us to then move forward with a series of projects that we have mapped out.
Well, that's a key issue for us, of course, but it shows the importance of the regional work that I think is becoming more and more obvious to folks as local budgets get tight on everything, and the need to reach out to Board of Selectmen, to other Board of Selectmen, state representatives to other state representatives. How do you find the regional caucus, in a sense, that we have in the greater Winchester area?
I mean, I think it's a great point. It's a very interesting and challenging issue because we all sort of each town likes its own autonomy and likes to have its own town meeting and make its own decisions. And but we're increasingly getting into a world of scarce resources, and where we have to find ways to do things together with our neighbors. And we have examples already. For example, we have an educational collaborative where with Lexington and Arlington and other communities for students who have special needs, and so those communities came together a long time ago to so we have examples like that, but we're going to have to do more of that, in areas like, I think, in public health and building inspections, maybe in public safety. There's some area opportunities, and certainly when it comes to something like flooding, that is a regional issue, and so we, you have to do a better job at working
Do
together.
you feel a sense in the House of Representatives of awareness of the need for regional cooperation on these things?
There absolutely is. And we do have the area planning commissions, like the MAPC. So there are some there's some ability today. There's some organizational ability to do some of that regional planning, but I think we've got to get better at it and smarter about it. And I think one of those areas is in regional and more regional school districts. I mean, Winchester's probably large enough that that wouldn't make sense, but there's certainly a lot of very small school districts out there where you have to ask yourself, does it make sense to be standalone, or should it be teamed up with surrounding towns?
Well, some of these issues are much bigger than we can handle all by ourselves locally, as much as we try to. And one issue which has been huge in the news, of course, all these issues are very newsworthy, the healthcare piece. Now, we've gone, since you and I talked the last time, we've had the national health piece, which of course got a tremendous amount of attention. And it may be a while before it has an effect on what we've done in Massachusetts. And I don't know how much the legislature can get into it in the short term, but there are things which the governor has talked about in terms of having the insurers be reviewed for their plans, and maybe more discussion about what the hospitals might have to do in the near term. And of course, there are much longer term issues too. But how do you see some of that discussion going at the state level?
In my mind, this is the single biggest challenge we have facing us at the state level and nationally. And I think the federal healthcare law will do a lot to start to address access to healthcare, but that's largely not the issue in Massachusetts because we have 97, 98% now. The problem we have is containing cost, and that's the continued increase in costs for healthcare, for health insurance, is putting at risk all the gains that we've made in access. And it's the biggest feedback I hear from small businesses in our district and from many families as well, because health insurance premiums, are going up double digits. I heard some stories the last several months of small businesses that were facing 30, 40, 50% premium increases. I'm sure you've heard those too. So that's just impossible. You can't sustain that.
This is the thing. I mean, and I know you'll be working on it in the long term. At the public level, it's so important, local, state, and federal. And it does deal with the cost issues, which we have high in Massachusetts, and also, as you say, we have pretty good access. But then the question is about access to the appropriate levels of health care for the different kinds of circumstances. And that's the longer term. And you just mentioned the nearer term, which is the 30, 35 to 50% increases for smaller businesses in some cases, which have to do with when there are only 4 or 5 or 6 employees, and 1 or 2 have a certain problem, or the age differences are a lot. But the need for something in the near term is pretty dire.
And the governor took it's not maybe unprecedented, but certainly a step that you don't take lightly, and that hasn't been taken in 20 years, which was he forced the insurers to come in and present their rates for the small business market, small group market, and they disapproved most of those rates. That really sent a shockwave through the healthcare market, and I think that was an indication of how how unsustainable this is. So that's not a long-term solution. I think that's a near-term sort of try to put the brakes on. But longer term, I mean, we've got to, I think, move forward with a number of major reforms, and it has to it can't be imposed by the state and policymakers. It has to be done together with doctors and hospitals, community health centers, and insurers together. And there's some good ideas about how to do that.
Well, I would say the Massachusetts legislature has been maybe the most active in the country as a state legislature on this issue. And I say that looking at it from the employer point of view, that a lot of things that have been done by the state legislature have involved employers, employee groups, consumer groups, in a way that I haven't seen in other states, frankly. And it's put us ahead of the curve. Yes, we're the most expensive, but that's partly because we have the most active teaching hospital circumstance in the country, and a lot of other things that are
some of the most advanced healthcare. Technically, we see some of the most difficult cases also.
And it's a high-cost state around all the other things that are related. So, and I would say that in my career, my lifetime, I haven't seen it ever this active on cost management committees and cost management plans. And that's going to take a little while, and so people naturally need it now. They get frustrated. But I do think that the legislature is tuned in, as I would say, to this issue more than any other state legislature. and that's
Yeah.
a good thing. So you'll be
That's good.
spending a lot of time.
Well, I am. I'm fortunate to serve on the healthcare committee,
Yeah.
and that was a good assignment as a freshman legislator. And I'm actually planning to sit down with the Speaker of the House in a couple weeks to talk about this very issue, and my interest in continuing to
great.
stay very active.
great.
My hope is before the end of this legislative session, we can maybe address some of these very near-term issues. I mean, there's some simple, lower-hanging fruit, if you will, that we can do, like limited enrollment periods, some very straightforward things. And then I think this hopefully will be the top priority going into the next session, would be the issue of payment reform and more major changes in the way we deliver and pay for health care.
I think that's great. I think you will have a lot of opportunity, and I would say that these things don't happen quickly. We're talking about a few generations worth of a system that's been built
That's
up
right.
a certain way. And I think there's a recognition that that can't continue exactly the same. And the question is, how do you make the changes?
That's right.
And they can't be abrupt, really.
And you don't want to disrupt what's working, and there's nothing more important than a family's access to health and health care. And it's also the most important, one of the most important sectors in our economy in Massachusetts. And I would add that I think there's also a great opportunity in cost containment reform for community hospitals like Winchester, because it's a hospital that has great results, great quality care at lower cost than say the large hospitals out of Boston, Partners, and there was a very compelling report and analysis by the Attorney General. I'm sure you've seen that recently, which showed that the market is not functioning properly in healthcare, and because of market power, certain hospitals, largely these big teaching hospitals, are able to get much higher rates.
This would be a great
from their
topic for us
insurers,
on one of the in-the-house sessions because of your work on the healthcare committee and the level of issues, the number of issues that are involved. But absolutely, and the Attorney General's report shows that. But I would say also, it's not a but, it's that a lot of the differential is subsidized by both public and private.
Yes.
And so when you have the subsidization for what I might say is the less appropriate choice but more expensive choice on the same kind of health care, naturally the demand, which isn't tied to any kind of cost on the part of the person using the service, is going to go towards the subsidization. And that's an issue for a longer talk another day, but it's something, and I know the legislature has got a key role in, and it's going to be very important down the road.
Well, the important thing is we've got to keep a laser-like focus on it, because the problem's not going to go away.
No, that's right. Now, you've only got a month and a half or so, or a couple of months, I should say, because we've got a couple of months left in this session, and the issues are getting very excited looks from the leadership in both the House and the Senate. And are there certain things that you see coming at us in the next couple of months that would be in the news and that you're going to be in the middle of?
Well, there is a rush on to before the end of the formal legislative session, the end of July. I think some of the priorities will be economic development. There are a number of proposals, ways to continue to encourage build on the recovery we're starting to see in Massachusetts. So potentially some things to help small businesses, tax credits. Also, there's a proposal to get more bang for our buck from our various economic development agencies that we have in the state, and there's a number of different agencies, and some questions about could some of that be consolidated and run better.
Okay.
So I think there'll be a proposal, a package on the table, that we'll look at in that area. Another area that's getting attention is this area of what's known as CORI reform. So that's our criminal offender record system, and the whole idea here is to help after people have served their time, their sentence, to be able to put them back to work. That's the best way to ensure they're not going to become a repeat offender. And that's a big problem today. A lot of people who served in many cases for minor offenses then have this record and a very difficult time being able to find employment, housing, and become productive citizens. And this CORI system we have has lots of problems with it.
And I
we
understand
need to fix that.
It's not an attempt to keep the information of any kind of a criminal record away from an employer, but to bring that up after the employer at least gets a chance to know the individual.
That's right.
'Cause I think what does happen, and this is the discussion, isn't it, that the awareness ahead of any interview
Yes.
sometimes cuts the interview off.
That's right.
And that's really not fair to the individual who really has changed their way of life, wants to get good
Right.
employment and be a good citizen. So
That's
discussion.
certainly a part of this, is to at least give somebody a chance, a foot in the door, certainly not to hide the information that they have this criminal record. But also there's this system is known to have lots of problems with it, lots of false information in there, and that needs to be addressed. So I hopefully will take that up as well.
Well, we're going to have a chance to talk about some of these things some more. This half hour goes by all too fast. It's incredible when we get together, because we could keep going on a lot of these things, and we will.
We
in the
could, but we
future.
might put our audience to sleep.
This is
So.
okay. They may not be as interested on the detail. They don't go 3 feet deep, but
Right.
we'll look forward to the next session
Right.
too, and we'll get together before this legislative session is over, because there are a lot of things that are going to be in the news, and keep writing those pieces for the local press, because they make a big difference. That keeps us up, and but we want to come back to WinCam because I know a lot of folks do enjoy having the conversation
Well,
with you.
I enjoy having the opportunity.
And I'm pleased to be able to help that happen. So
Great.
I want to say that we've been sitting with Representative Jason Lewis in our In the House program, and it's a pleasure to be able to have a discussion on these state issues. And the House of Representatives will be meeting through July. They've already passed the budget at the House level. It's off to the Senate. It'll come back for final approval by Representative Lewis and his colleagues. And we'll be back during that period to talk about some of the effect it'll have on our local activities. But
Sounds good.
thank you, Representative Lewis, very, very much. I
Thank
look
you.
forward to the next
Great.
session.
Thank you, Alan.
Okay, great.
What's going on?
Welcome to In the House with Representative Jason Lewis. My name's Alan McDonald, and it's my pleasure to be hosting Representative Lewis for this session of In the House. Representative Lewis, pleasure to have you here.
Hi, Alan. It's great to be back with you.
How good is it to have your state representative sitting at your kitchen table to talk to you about what's happening in the community? And that's our opportunity, this and each session of In the House. And you've had a lot of activity in the community. I know you recently had your usual community forum and heard from a number of people on issues that related to state budget and school financing and all kinds of local things.
Right.
And tell us a little bit, I know folks are interested, how those help you, those sessions help you in your work.
Well, they helped tremendously. This was a community forum that Senator Jalen, Winchester State Senator, hosted along with me, and we held it at the Jenks Center. We had wide range of residents from the community who attended, and it helps us understand what's on folks' minds and what their important issues are, and allows us to get direct feedback on some of the issues that we're working on right now in the state legislature.
Was there much interest in the healthcare costs, which we do hear about in the media? Was that also something on the minds of people who come to the community forum?
Absolutely. We heard feedback around health costs, certainly health insurance costs, rising costs of healthcare for individuals and small businesses. We talked a bit about the state budget and why the budget is so tight and what we can do about that, and also the economy. We talked about driving, and I know we're going to talk about that a little later, and trying to make our roads safer. There was discussion about our schools and new school buildings and school funding. We also had some interesting conversation about shared parenting and the whole area of family court, and some interesting work that's going on around alimony reform, child custody in Massachusetts. A lot of those laws are quite old now and need to be updated.
Well, I know so much relates to the state budget, and each year your calendar in May and June, I know, is chock-a-block full, because you want to get that state budget done in time for the new fiscal year, which we've just gone into, July 1, and off we go to a new fiscal year. And I know from the outside, watching those numbers, you have less money to work with in terms of state revenues looking ahead at the next fiscal year than you had 3 years ago, for all kinds of tough economic reasons. But how are you faring with that, with your co-legislators and trying to get that budget done?
It's been very challenging. This is only my second budget since I was elected, so I only have the benefit of seeing it last year and this year, but some of my colleagues who've been working in the legislature for longer say they've never seen budgets as difficult as we're seeing now. And combination of both the recession causing tax revenues to fall, as well as a need for certain services that the state government provides in terms of a basic social safety net, and having demand for those services going up in a recession. So those two forces, there's no way to reconcile those, and we've in this budget in particular, there are no increases in taxes or fees, so it meant basically having to make some very difficult choices about programs that would be cut, trying to look for cost savings wherever we could, look for ways to do things smarter. And then also we are fortunate in still having some federal stimulus money for health care and for education to help us get through this rough patch.
Well, that stimulus money has helped. We have had, going back to 2 fiscal years ago, just before as you were coming into the legislature, that was 10% of the state budget was on one-time funds. It's a little better than that right now, a little less than 10%. But in truth, in fiscal 08, we're going into fiscal 11, we had state revenues of just under $21 billion. We haven't got back to $20 billion yet.
That's right. And of course our costs have gone up, many of them along with inflation. And in fact, healthcare costs, which consume more than a third of the state budget, have gone up by a greater than inflation.
So it really does
affect. That's what's putting a very tough squeeze.
And we'll talk a little bit about how that affects Winchester, but when you're in the middle of a very difficult job, and we appreciate what you're doing, frankly, the employment picture for Massachusetts, when we grew from 1970 to the peak in the late 80s, from 2.2 million people working in the state to 3.1 million working, we're still 21 years later at 3.1 million people working in the state, which in terms of growth of revenue, and because the population has grown a little since that time, but in terms of the needs of the citizenry over that period of time, those have grown. And as you say, the expenses have grown. So 21 years has gone by, and we have the same level of employment and even a diminishing amount of state revenues compared to only a few years ago. That affects, as you're going to say, I think, the local funding that you're hearing from us all the time about the Winchester share of local funding, and of course, it can't be expected to go up.
Right.
Hopefully, we
Well,
keep it the
that's-
same, but yeah.
Well, we do our best. That is a top priority within the state budget, and that's between the funding for public schools, which is the Chapter 70 funding, and some additional local aid. That's about $5 billion out of a $28 billion budget. So that's after healthcare spending, that is the largest area of the budget, and we really tried hard to preserve that as much as possible the last several years. And fortunately, in Winchester's case, because of our growing enrollment, we actually saw an increase in our Chapter 70 funds and our local aid last year because of that. This year, it's a slight decline, but less than most other communities because of that enrollment growth.
That's very important. And I know you're working on economic development issues. There has been a lot of discussion in the House of Representatives and the State Senate too, I think, on economic development, and you're still in session.
Yes.
So even though the budget has been set, you've got another month worth of many issues, frankly, I
Yes.
know. But economic development is still a big piece for the things you're working on.
Absolutely. I think the top two priorities still remaining in this session, which ends at the end of July, the formal session, are to have some kind of economic development package, probably mostly focused on small businesses, some things to help them, encourage some additional hiring, some tax credits, streamlining of some of the state agencies that deal with economic development. So that's one of the top priorities. The other one is trying to address healthcare costs, again, for individuals and small businesses. There's been a lot done in that area over the last several years, but we obviously need to continue to do more.
Well, it seems to me, and you've opened the door for this, an opportunity for public-private partnership on things that we look forward to in economic development, but you did a lot on the Stone Zoo.
Yes, that's close to home.
Public-private. It's close to
Yeah.
home, and it's a biggie for us. Tell us a little bit about that process and how how we're doing there.
Well, thanks for bringing that up. That's something I'm very excited about. It's on a personal note, it was my first bill that I filed that has passed the House and the Senate and was signed by Governor Patrick last week. And it's I think it's a good story because it was, I think, President Obama's Secretary Rahm Emanuel, as Chief of Staff, who said, something like a crisis is a terrible thing to waste.
True,
And that really is true in this case. Some of our viewers may recall about a year ago, due to the state's fiscal crisis, the budget for the Stone Zoo and the Franklin Park Zoo was cut almost in half. And obviously, they don't have a very large budget, and they have high fixed costs. You have to feed the animals, you have to provide insurance and veterinary care, so they can't just take their cost structure down by that much overnight. And as a response to that, with Governor Patrick's leadership, a working group of business and community leaders and legislators was set up. It met all last fall and worked together with the management of Zoo New England, which runs the Stone Zoo and the Franklin Park Zoo, and looked at their operations, looked at their finances, looked at their strategy to try to see how do we ensure their near-term survival through this fiscal crisis, and then what can we do to make them successful longer term, and most importantly, how do we make them more self-sufficient? Because you want to, over time, have them rely more on corporate sponsorships, foundations, memberships, and less on public financing. So as a result of that, one recommendation was to restructure their governance and double the size of their board of directors, bring new people onto the board who could frankly help them with fundraising and corporate outreach. And so that was, their charter was set in law about 15 years ago, so we had to change that, and that's what the legislation does, and that's what the governor signed last week. So
That's great.
hopefully this will help both zoos, which are very important to our community and to the greater Boston area, to expand and grow and continue to provide a wonderful experience for local families.
I think it's a good thing to remind people of what an asset we have right next door. And I don't know if it's going up in terms of use or down in terms
It's
of
been
use.
increasing significantly and the last several years. Up to now over 600,000 people a year from all over certainly all over the state, all over the world who visit. And the Stone Zoo is much smaller, but wonderful for young families. My 7-year-old daughter had her birthday party there in September last year. They do a great job, and they do a wonderful. They have a great educational mission too. Lots of school children visit for free, and they're obviously involved in conservation efforts worldwide.
Well, that's a great point. So would there be more emphasis even on some of those educational programs? I think maybe that might come out of that.
I think so. They would love to do more of that. So the more resources they have, they definitely, that's a key part of their mission, is to expand in, the educational side of the
That's
zoos.
great.
And that's really where zoos are moving around the world. It's less about locking up animals for people to go see them. It's more about appreciating wildlife and conservation and education. And that's very much what they're doing.
When I was young, which was a long time ago, one of the early TV shows was Zoo Parade out of the Lincoln Park Zoo in Chicago.
Yes.
Every Sunday, I guess it was, but that was what it was. It was an educational program about the animals, and this is a great opportunity to have right in your backyard,
Right.
frankly. So it's
Well,
good.
I
So-
encourage any parents that are watching us and haven't yet been over to the Stone Zoo, just over in Stoneham, to go over and visit. It's a
Well,
great,
thank you
it's a
for
great
doing that.
afternoon.
Thank you for your work on
experience.
that. That's going to be a big help. And I know that you have expanded the size of the board, some good community leaders and people that can help, which is the norm with these kinds of institutions. So
That's right.
we should
You may
be
even
doing
be getting a call soon.
Well, I'll be
Another board for you to serve on.
I'll be a frequenter of the zoo. But that's great. And tell me too, because you've been working on a number of things, but there was recently a safe driving bill that went through the House and Senate, which seems to me to be extremely important. So many things that we've heard about accidents on the roadway for people who are distracted drivers.
Yes.
And really something needed to be done. So tell us a little bit about what you've
Yes, I'm pleased. It's an important step forward. I think the legislation doesn't do everything we might want to do to make our roads safer, but it's important. It has passed and was signed by the governor. I think it takes effect in October because there's some time for the RMV to develop some guidelines and regulations. But it basically does three things. It bans all texting. So everyone out there, no more texting. Shouldn't be doing it anyway, but
I'll
no
be doing it,
texting while you're driving.
Right.
Studies have shown it's even far more dangerous than even driving drunk. Sending messages or reading email. So that's the first thing it does. And then second thing is for junior operators under the age of 18 and for people who drive public transportation, school buses, and so on, no use of any mobile devices will be allowed. So you can't text or talk on the phone for junior operators. And then third is for seniors, people over the age of 75, they will need to renew their license in person, and that there'll be an eye test and make sure they're still able to drive safely. So there's some other things, but those are the three main areas, and I think that was a long time in coming and overdue.
I mean, that's great work. I mean, in my opinion, and I think for all of us, as we read about the tragic circumstances, you want to prevent that. You want to help people out.
Right.
I saw even while you were working on that bill, a study that people walking and texting are bumping into telephone poles and falling into manholes and all kinds of crazy stuff. So
I tell you, I got an email from a lady today, a constituent, who said that she thinks the next step is we should ban talking on cell phones while you're crossing the street for that very reason.
maybe so.
But there's only so far we can go in terms of legislating good behavior.
That's right. You won't be able to do that. But
At the end of the
that's
day,
right,
people
too
have
much.
to be responsible.
Now, on the local level, you've been involved in stuff here, of course, too. We've had a situation downtown, and there's so much attention, which I think is going to help us out with downtown. We go through these cycles.
Yes.
And we've been pretty fortunate in Winchester with the downtown development, really since the redo of the downtown in the 80s. But you've been working on the commuter rail circumstance
Yes,
a little bit
yes,
downtown. That's a
yes.
half a century old where we need
Yes,
to
it
go back
is.
and take
Back
a
to
look.
the 1950s
Sure.
when the station was built, and absolutely. And you mentioned the last time. I think it was Representative Whip Saltmarsh
Yep, very
was
helpful.
so instrumental in those days,
Yep.
and the selectmen at that time, and the downtown is such a wonderful asset to our community, and I think there's a real opportunity to reinvest in the downtown, to bring in some new businesses, some new restaurants. We have a new one opening up very soon, which I'm sure we're excited
interesting.
about, the
Yeah,
Black Horse
that'd be
Tavern.
interesting, yeah.
So then there's a lot of exciting opportunity for mixed-use development in terms of retail, along with commercial and residential. More people want to be able to live, walking distance to public transportation. So there's a lot of opportunity, and I think our selectmen and our planning board, and I'm sure they've also been on WinCam talking about some of those plans. But a key linchpin of that is the commuter rail station, because that obviously runs right through and is a key attraction. So we've been in discussions with the MBTA now for the last year about plans to rebuild the commuter rail station and really make some very significant improvements. And I'm very pleased that that's now moving forward.
Well,
so we've got $1 million in the MBTA's budget for this year that started last week, and that will do create the design and the plan, the engineering specifications and architectural drawings for the new station. And then after that, we will have to secure the construction funding to build the new station.
Right. Well, I think that's wonderful, and you're right. We've been very blessed by having an active downtown, and I think one of the attractions of the community to folks is that there's such easy access to the capital city from Winchester.
Absolutely.
And, of course, having a nice commuter rail access is going to be important to us. It always has been, and it can't be ignored for too long in the upkeep. So
that's right.
This is
and
big
as everyone knows, we've had some safety issues, and unfortunately, those MBTA is doing immediate work to address those. But we need to invest in that station.
How do you find, from the legislature's side, the merging of the MBTA and the all the central artery stuff with the Turnpike Authority and the normal Highway Department, Conservation and Recreation, Roads and Bridges, but all under one secretariat now?
Yes.
Is that helping you in your work?
Yes.
Or, how do you find
Unquestionably, I think that has gone. It's gone really well. That was the transportation reform that was passed last year, and eliminated, as you said, the Turnpike Authority and created one Department of Transportation, so we don't have all these separate autonomous agencies. And they are, the planning, the coordination is much better. They are, as a legislator, when I have issues that I have to deal with, it's much simpler now. There's a single point of contact, whether it's with the MBTA or Mass Highway. And I think the promise of realizing several $100 million in savings, we are actually well on our way to realizing those, because those employees are now all going into the state's health insurance program, and that there's some savings there, and as well as just having some economies of scale. So I think that was a very positive change. I give a lot of credit to Secretary Mullen, who's now the head of the whole Department of Transportation, and I think under his leadership we've made a lot of progress.
Well, that's great to hear, and I think the management of state government is pretty difficult, so because there are so many areas that need attention, and I think sometimes the centralization of those things can make a difference in the positive side, and I would hope that it would, as you have to work with them, because it's very important. I think that some agencies are more visible and active than others, but I think transportation is probably something you run into those issues all the time.
I'd say next to healthcare and health insurance issues, transportation was right up there.
Okay.
Whether it's
Makes sense.
MBTA or roads maintenance, potholes. That's
How do you,
critical.
speaking of healthcare, because you're right, there it is, as you say, it could even be number one. Financially it is, that's for sure these days, as the government on the federal side looks into it too. But as you're dealing with the healthcare issues, I know that there was a pay commission, a payment commission, pay reform commission that came through with some thoughts. And if I am correct, Speaker DeLeo said that we would not necessarily take that up this particular year because there's so many things going on, but maybe in 2011. But do you hear a lot of discussion among your colleagues about the healthcare issue?
Absolutely. I actually had an opportunity to sit down with Speaker DeLeo 2 weeks ago on this very topic, because I do serve, as you know, on the healthcare committee. And we talked about this, and I think what I was urging him was that we move ahead before the end of the session with efforts to contain healthcare costs, even before the state really tackles what you're referring to, which is
Right.
this payment reform, moving away from a fee-for-service system to a more of a unified global payment model. And that's a major change, and we need all constituencies, physicians, hospitals, businesses to be involved in that change. That's a major change in our healthcare system.
Okay, sure.
And I think that's generally the right direction to move. But what I hope we can do is in the near term, there's some smaller changes we can make specifically, I think that can help small businesses.
Is there much discussion in the Healthcare Committee about the local cost of healthcare? I know there was a push or a discussion about
Yes.
making it easier for communities to join in the group insurance
Yeah.
commission at the state level. But of course, the idea about existing contracts and health benefits and how do we
Right.
not push those aside abruptly, but looking at the longer term, I'm looking at this now from the town budget point of view, which of course we spend so much time with at town meeting, but that's an area where for many communities, the allowed 2.5% increase in the revenues plus new building only really equals the cost of the healthcare increases in the budget sometimes. And not to violate contract negotiations, but there has to be some way to get the hands around it. I know that that's
Yes.
going to come to your committee.
Yes, it's a really important issue. The cost of health insurance for Winchester and for other cities and towns has just continued to crowd out other areas of spending. I mean, it's the same problem we're having at state level, and frankly, the federal government has the same
Everybody's
problem.
got it.
And
Everybody has it.
it's crowding out spending on education and transportation. So we have to tackle it. The state took a step in that direction by allowing communities to join the state's health insurance system. And in fact, Stoneham, which is one of the communities I represent, has done that.
Okay.
And they realized some significant savings by moving their employees into the state's program. Winchester is in a different program that's kind of similar. But this issue has been, there was some attempt to really tackle it, but it never made it into the final budget because there was just no consensus. I expect this will continue to be a priority right when we start the new session.
I think
Next
it's it's a big one, and I think when working on the local level, Winchester has, the town employees, in my opinion, have always been very good about participating in the healthcare cost discussions.
That's
And-
right.
And in fact, the employee share of the Winchester town employees is larger than a lot of communities,
Right,
frankly.
that's right. I think it's
so
25%.
we're-
There's a misperception out there, I think I hear a lot, that people think public employees don't contribute toward the
They
cost
do.
of their health care as private sector. And in fact, now it's, in many cases, not different at all.
That's right. No, so we don't, in this community, it's not as dire as it is in some communities. And in some communities, 5 property taxpayers, average property taxpayers pay the health care benefits for one
person.
local employee. Now, that's only to say that,
Yeah.
that the ratio is high and it has to be gotten under some control, because otherwise you won't be able to
Right.
have the public services
Yep.
that we need to have. Yeah.
Well, I think it's interesting. Winchester, actually, I think it's a very good model here because Winchester, part of what you're doing when you're finding ways to reduce premium costs is you're shifting more, you're increasing copays, you're increasing deductibles,
Right.
as everyone knows. And so really what you're doing is you're shifting more of the costs to the 20% or so of people who need more health care. They're ill, they have chronic conditions, they're unfortunate enough to be in a serious accident. But I think one thing Winchester's done, and could be a good model, is having essentially a safety net. So they often called a health reimbursement account. So for those individuals who are unlucky enough to really have to spend a lot of money for health care for themselves or their family, this would ensure they wouldn't be out of pocket more than a certain amount, say $2,000 or whatever that. But that's a way to achieve the cost savings without just shifting all of the burden to those people.
So let me, we have a few minutes left, and I want to take advantage of you're at the kitchen table here and conversation. Tell me how you've enjoyed the term. You ran a very good campaign, and you got elected easily because the voters were very supportive, as they should have been, and it was a good campaign.
Right.
And you've had this opportunity to see what it's like. Tell me a little bit.
Well, I'll tell you, I had never done anything in government before. I hadn't
other than volunteering at the local level. So I really didn't know what to expect, and it's been a really interesting and challenging, rewarding experience. And I think the most rewarding part of representing our community is not even some of the bigger policy issues that we often talk about.
Sure.
It's just the day-to-day working with individuals, working with community groups. I get lots of calls from members of the community who are struggling with, whether it's their keeping their house or unemployment issues, obviously in the last several years, health insurance for themselves or their children, fixing potholes,
Fixing
their
potholes.
roads, building a better train station or new school buildings, and those are the things I spend most of my time on, and those are areas you can make real progress, day to day. That doesn't take months or years to see the benefit, and that's very rewarding.
Good for you, because I think people don't realize sometimes that it is the nitty-gritty that is the most of your work.
Yes.
And it's true at the selectman level and the school committee level as well.
Absolutely true.
And of course, you want to get involved in those policy issues because you want to make a difference. But you have to do it one voter at a time,
That's right.
as they say. Yeah.
That's right. Well, the way I think about it too is you have your portfolio, if you will,
Right.
back to my business days.
That's
And
right.
so there's things you work on that you can impact today and next week and next month, and then there's things you work on, you try to slowly push that rock up the mountain that maybe you'll get there in a few years.
It is important to look at the long term, isn't it? I
You
mean,
need both.
People often People often ask me, why can't government be more like business? Of course, they ask a lot of people that. And I say, well, because in business, somebody's usually in charge.
That's
In government, there's not one person or
That's
even
right.
one committee that's in charge fully.
That's right.
There's a lot of people that have to be listened to and
That's
involved
right.
in the process. And you
That's
can't
right.
do it right away. You've got to
Plus-
have the long term.
Well, that reminds me of the great quote from Tom Friedman in his latest book when he said, if you could be China for a day,
Yeah.
but not for two.
Well, that's the truth. So, and some folks need to realize that when they do run for office, which I encourage everybody to run for office who has the slightest interest in the public service, but you do have the nitty-gritty to worry
Yes.
about, and you have to enjoy doing that. Just when people tell me they'd want to be whatever, an FBI agent, I say, well, would you be happy doing a stakeout for 3 days behind somebody's back door in order to do the bigger things?
That's
and
right.
they say, yeah, okay, well,
That's
all right,
right.
then you're ready. But that's
Then-
right. So good for you.
Great.
This has been an enjoyable opportunity, and I'm looking forward to more. We're going to only have another minute or so to say goodbye to the good folks who have been with us, and I just want to say how much I enjoy the opportunity to be with you and to have the chance for people to see what Representative Jason Lewis is doing, because I know you're working very hard.
Thank you, Alan. It's always a pleasure to do the show with you and to work with you outside the show as well.
That's great. Well, with the Winchester and Stoneham are the beneficiaries, and we appreciate the Stone Zoo. We're going to get up there and enjoy that, as a matter of fact. And the work you're doing with our commuter rail station over time, that's the long term.
That's right.
That's the long term, but we have to start somewhere, so we appreciate it very much. But I want to thank all the folks for tuning in to In the House with Representative Jason Lewis, and we'll look forward to the next opportunity because there's a lot of work still being done. So thank you, Jason, very much. Appreciate the chance. Great.
Thank you.
Yeah.
What's going on?